Prenatal care is vital for both the mother and the baby. The Fetal Diagnostic Center at St. Jude Medical Center monitors life-threatening complications for the expectant mother and her baby. We spoke with Dr. Julianne-Toohey about the specialized care provided.
The Fetal Diagnostic Center is an outpatient facility for pregnant women. We provide very high-resolution ultrasound where we can look at the baby's anatomy in great detail. And in addition to the ultrasounds, we provide genetic counseling and perform amniocentesis if the patient prefers. The Fetal Diagnostic Center is actually approved by the state of California to see patients who have had any abnormalities in their AFP screening test. In addition to that, we have a highly trained and qualified nursing staff who can provide fetal testing. This is one of the most important ways a doctor can ensure that the pregnancy is healthy and happy. We see the patient twice a week, put the patient on a fetal heart rate monitor, and see how the fluid is around the baby. I am a maternal fetal medicine specialist or a perinatologist, and what that means, it's an obstetrician who has subspecialized in high-risk pregnancies. I take care of women who have special problems, women who have diabetes, high blood pressure, lupus, or other medical conditions. I also take care of women who've had pregnancies that are trying to deliver too early, have babies that are going to deliver prematurely. We recently had a set of triplets that delivered here at St. Jude's, and it was a healthy triplet pregnancy that had a great outcome. That's what we try to provide our patients. We like seeing patients as early as possible, especially when women are taking medications or who are at high risk of having any malformations for the baby, because the earliest part of the pregnancy is a time where the baby is maturing and forming. So we recommend that we see a patient early in the first trimester. We are able to see any woman who's at increased risk of having a complication with her pregnancy at the Fetal Diagnostic Center, or any woman who might have a baby who's at increased risk of having a birth defect. For example, women over 35, women taking certain medications, or women with certain medical problems like diabetes. Of course, we're able to see any couple who simply has questions and concerns about their pregnancy. The Fetal Diagnostic Center is an outpatient center that sees women prior to the delivery of their baby. So once they're delivered, we don't see the patients. So as a perinatologist, I work closely with a woman's own physician to take care of the patient and give him consultations as to how best to provide for her care to ensure that the patient's pregnancy has the best and happiest outcome.